Gender-based violence is in the spotlight once again following the quarterly stats that were released on Friday. The statistics showed an increase of 72.4% in rape cases. At the same time, the country is also experiencing a DNA backlog. So let's discuss this with Vanessa Lynch from DNA for Africa. Vanessa, such a pleasure to be in your company this evening. These statistics that have come out around how between April and June 2021, we saw about 10,000 or so, more than 10,000 rape cases in the country. This comes obviously off the back of this DNA backlog that we've been lamenting on for quite some time now. And from what we understand, it could take up to 3 years before a victim even gets their time in court so that they can see justice prevail. How can it be?
This has been an issue that has been brought to the attention of the DNA board, the ministry, the forensic science laboratory for quite some time now. And we shouldn't be surprised that the stats are now showing the effect of not using our DNA database effectively. So I think we have a leadership crisis. I certainly feel that the DNA board, as well as the portfolio committee and the ministry, need to convene and account to the public as to whether they are in fact implementing their turnaround strategy plan and how far they are in terms of that plan, because we have heard silence since March. They've acknowledged there's a problem, but we haven't really seen the results of that acknowledgement. So that's really what we are calling for now.
Where's the problem, Vanessa? What is the problem?
There needs to be a greater accountability to us as a public in terms of what the problems are. You know, we're talking about a backlog crisis, but they haven't actually, they've said that they've implemented the contracts, but then I hear from the ground that Treasury aren't actually issuing the purchase orders in order for them to procure the chemistry that they need to do the analysis. There's talk about public-private partnerships, and perhaps we need to look more at that. Can perhaps reference samples taken from known persons be given out to some of the private laboratories to facilitate this backlog? We possibly need more private partnerships to get involved with technical committees to oversee the issue. Clearly, the DNA board is out of their depth. We never hear from them. I don't even know what they're doing. I was part of a DNA board previously, and we certainly used to meet at least every month with the forensic science laboratory and acknowledge what the problems were and try to facilitate that. So I really think there needs to be more accountability. We as the public, literally need to understand what the issues are. You know, we can talk about it, but there needs to be more intervention.
It sounds like there's a big problem where budget is concerned and the budget allocation to, for example, the National Forensic Services Laboratory so that they can be able to do their job. That somewhere, somehow, between National Treasury issuing purchase orders, which means clearly there's a money issue here, there's a money crisis, because unless you are able to capacitate the laboratories, they're not going to be able to do the work and they're not going to have the resources. Is that coming out clear, that indeed there just may be a budget crisis here?
I'm not sure. I'm not sure that's correct, because there was withdrawal of funding. They were then given 250 million rand to operate the forensic science laboratory. They were awarded the contracts based on that allocation of funding. So purchase orders it's more operational. There needs to be more collaboration between the different departments in order to ensure that operations are sequential. I don't think COVID assists the situation, because, you know, you're working on limited staff. There's obviously decontamination that's occurring, although in a DNA laboratory there should never have to even be a decontamination process, because it's supposed to be a free environment of any contamination. So you know, we can speak about what the issues are, and what we're calling for is really for the leadership to come forward and speak to yourself. Where is the DNA board? What have they seen as the issues as to why this is not progressing in the way it should be progressing? Why are we still seeing these statistics going sky high? Why are we still hearing about the backlog increasing and not reducing. Where is the accountability? We have a COVID dashboard. We see daily what's going on in the Ministry of Health as to what the numbers are, whether they're up or down. We need the same thing. We need the same transparency as to understand if they are in fact doing something. What are the problems they're experiencing? Maybe we can be sympathetic. Maybe we can provide assistance. That's what we're calling for in terms of My Voice for Justice. It's asking for access to information. We deserve that.
Yeah, and you know, we're talking here about access to information as well as perhaps lack of operational efficiency or effectiveness within, you know, whether it's with the SAPS or the DNA board for that matter. But here's a crisis, is the fact that we've got 10,000 and possibly 6 rape cases, or 10,000 and possibly 6 perpetrators that are out still walking the streets after having raped someone. And the reason why we're seeing them walk the streets is because justice has not been served. They won't find their day in court, well, at least for maybe possibly another 3 years. That means, if we have to put it in simple plain English, there could be 10,006 rapists that are walking around in the streets of South Africa with no one even knowing when their next attack may be.
Correct. Correct. And a DNA database has been shown in the past, and it's been shown throughout the world, to be one of the most effective methodologies in identifying serial offenders. And we have an infrastructure, we have the facility, we have a law, but we don't have an administration that is willing to implement it. So we can't talk about the issue of gender-based violence, and we can't acknowledge that we have an infrastructure without the two meeting together. And this is where I say that there's probably a leadership crisis occurring. We need the leadership to step up. They need to utilize the great laws that we have in place, the infrastructures that we have, perhaps, you know, look at public-private partnerships in order to assist. Because the identification of serial offenders is easy with DNA. Why are we not using the greatest tool available in the world in a country with one of the highest rape statistics? It's irrational. It's an irrational move from our administrations as to why they're not really stepping up this process. I do not understand it. We need to hear from them, not from me. You and I know it's a problem. Where are the leaders telling us why they're not doing this?
Vanessa, we're going to do our best to try to get the leaders to actually account for this, because it's, I think it could be called a travesty as it is right now when we're seeing that these statistics are showing 10,006 rape cases that were reported between April and June of 2021 alone. That could possibly mean that there could be 10,000 rapists that are walking around in the streets and nobody knows about them because they've not been brought to account. Let that sink in for a moment. To this story.